More Okanagan news for you now. They can talk, blink, and even cry, but fortunately, they cannot be injured. They are state-of-the-art patient simulators, and they were introduced today at UBC's Clinical Campus at Kelowna General Hospital. Robert BUFFAM has more on how they'll be used to train students and keep doctors and nurses up to speed.
Okay, we're going to defibrillate. We're going to go up to 200.
This looks like a life may be hanging in the balance, and that is the desired effect, as brand new patient simulators are tested at Kelowna General Hospital. Students and staff here are excited to try them out.
All of us here in the medical school can't wait to get in here as much as we can and start practicing.
I feel really bad.
Hey, Sam, how are you doing?
This is Sam, one of 2 mock patients unveiled today.
I'm feeling very dizzy.
Very dizzy, hey? Well, your heart's beating pretty quick. I'm just going to get some help.
Not only does he have a pulse and can talk, he mimics most physiological reactions of live humans.
Having cerebrospinal fluid come out his ears if he has a head trauma or at his nose, he can froth at the mouth.
He's controlled by computers that also assess how well he's being treated, including, for example, the quality of CPR compressions he's getting. And the high-tech learning doesn't end there.
And it videotapes and records the whole thing, and then we debrief afterwards, and the students can bring a memory key and take home their information and review it at any time so they can evaluate themselves over the years or over the sessions.
I don't feel a pulse. Okay, can you start CPR, please?
Sam and Harvey, a simulator focused on heart conditions, are a first for our area.
It's been a big void in the interior here for us to have simulated labs to practice for physicians and staff.
And they'll provide invaluable hands-on training without the potentially dire consequences of a mistake.
There's nothing like seeing, hearing, and feeling all at the same time.
This is great for us. I mean, one of the things I've always wanted our students, when they graduate from our program, is to be wonderful at clinical skills.
Sam, how you doing? You have a pulse with that, Lauren? Yep, I feel a pulse.
That helps.
That helps.
And with state-of-the-art training like this, students and staff here should be able to develop and maintain those skills.
I feel better now.
Oh, that's good.
In Kelowna, Robert BUFFAM, CHBC News.
Now, the new Patient Simulator Center is a joint effort between UBC Faculty of Medicine and Interior Health. The center and its patient simulators were largely funded by a private donor. This was the scene this morning at Kelowna General Hospital as a plaque was unveiled to acknowledge the contributions of Colin and Lois Pritchard. The couple provided $500,000 in funding for the center. Colin Pritchard says the donation was motivated by his respect for technology and the importance of medical training.
Well, it's critical, you know. I've had 2 life-saving operations, I would say. And, you know, as you get older, you realize how important good medical care is. And my hope is that some of these newly trained medical students will stay in the Okanagan.
In addition to their contribution to the faculty or the facility, the Pritchards also created an endowment fund for student scholarships. They pledged $50,000 for this fund, an amount matched by an anonymous donor.